Patient is walking into the room. Gait is normal, no sign of drift. Hi, I'm Britt and I'll be your nurse tonight.
Hello.
Would you mind walking back to where you were, and I'll teach you a few ways to walk, and I'm going to assess your gait, okay?
Sure.
If you wouldn't mind walking heel to toe, so just a normal walk. Gait is normal, heel to toe is normal. And then walk back toward me and do walk on your heels. And then walk on your toes. And then one more time, walk back that way. No drift is present. And then turn around for me. We're going to do a test called the Romberg test. You're going to lift your arms like this. Face them up toward the ceiling and close your eyes. No drift present and able to flip them normal. Range of motion is normal. Okay, you can come on in now. Just sit on the side of the bed, please. For your assessment a little bit, I'm washing my hands before. Like I said, I'm Britt and I'll be your nurse tonight. Let's go over your health history. What's your name?
Aaron.
Can you tell me where you live?
Mooresville.
Okay. What's the date of today?
July 12th.
I think it's the 15th.
Okay, July 15th.
Okay.
Okay.
Where are you?
In the hospital, Northeast.
And what season of the year is it?
Summer.
Okay. So it says you're 21 and an ice cream maker, is that correct?
Oh yeah.
Okay.
Scooping ice cream every day.
I'm just going to go over your assessment a little bit. You're obviously a male, Caucasian. Your primary language is English. And then what are you here for today?
I have excruciating pain in my side, back, and abs.
Okay. And your health history, whenever you gave it to the receptionist earlier, you rated your pain on a PQRST scale. So I'll just read it off and you can verify it's correct. Pain came on steadily, nothing has made it any better. Movement, eating make it worse. Q, is it sharp, stabbing pain in the flank area, rates 10 out of 10 at all times. It makes you feel nauseous as well as you vomit a few times, right?
Yes.
It is located in the flank area, rating to all over the back and abdomen. S is pain 10 out of 10 at all times, interferes with ADL, and it forces you to have to lie down at times, and you have to hold your flank area sometimes to relieve any pressure. And then T, pain started suddenly since yesterday, on 7/14 and lasts continuously. Patient states of buying groceries when pain started, and you said you had to lie down, but it didn't help at all, and you've thrown up a few times.
Yeah.
Okay. So we'll check that out after I get through a little bit more. So it says here you haven't had any chronic diseases or childhood illnesses. You denied any allergies or being on any current medications, and you overall have good health besides a couple surgeries and injuries, and you're up to date on immunizations.
Yeah.
Oh, but you do have a history of kidney stones from your mother and grandfather, right? Okay. Well, we'll take a look at that. Maybe you have a kidney stone. Okay, so I'm going to do your head to toe assessment and check out the pain in your lower flank area. I'm just going to go over your temperature was 100.6, pulse was 100, blood pressure was 136/88, respirations were 20 per minute, and oxygen was 100% on room air. Your height is 6'2" and weight 210. That makes your BMI 27.0, and your kilograms is 95.6. Is that correct? All right, well, I'm going to start your head to toe assessment now. And I'll keep you sitting on the side of the bed for right now, okay?
Mm-hmm.
No abnormalities, and in your health history you said you had no headaches at this time, right? Okay. So I'm going to assess your cranial nerves now. There's 12, so just give me a little bit of time, okay?
Mm-hmm.
Alright, so your olfactory is your smelling, so I'm going to put something underneath your nose and you're going to tell me what it is, okay? Alright, just shut your eyes.
Smells like alcohol.
Okay. Again.
Still smells like alcohol.
Okay. So I did each nostril, and I'm gonna look into your optic nerve, which is number 2. So, all right, now I'm gonna have you look into this, and then I'm gonna look back into your eye. Okay. Okay. then this chart over here, just read it for me to see how your test is.
Like read the letters to you.
Mm-hmm.
D-A-L-E.
Okay, looks good. And that tests your oculomotor, which is 3, and your trochlear, which is 4. Alright, and then your distant, sorry if I mispronounced that. I'm gonna look into this again, and then, actually I'm gonna use my pen light. Let me grab that. Okay. So, you need to look into the light, and then I wanna make sure your pupils dilate, okay?
Mm-hmm.
Or I'm sorry, constrict too. Okay. Looks good. And then look over at this one. I'm looking at your other eye. And I'm looking at your other eye. Okay, pupils are equal, round, and reactive to the light. And then I'm gonna have you follow my finger in and then look at the wall behind me and we'll test accommodation, okay?
Mm-hmm.
Alright, then look behind you. Alright, your pupils are normal and you can see great distance. And I'm gonna test your trigeminal, which is, I'm gonna have you look away and then I'm gonna rub this on your face to make sure your eyes blink at each time, okay?
Mm-hmm.
Okay, perfect. And then I'm gonna test your facial sensation. We're still on number 6. I'll put a sharp object on your forehead and your cheek and your jawbone and then repeat with a dull one, okay? So, close your eyes for me. Tell me if it's sharp or dull.
Sharp. 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 Dull. Dull. Dull.
Okay, perfect. And then I'm gonna test your motor and your trigeminal as well. All I'm gonna do is push on your cheeks right here, and then you're gonna move your jaw back and forth. And I'm gonna test to make sure you don't have a TMJ, okay? You open your mouth, shut it, and then move your mouth back and forth. Perfect. No clicking, and everything sounds normal. Now I'm going to number 7, which is your facial. Your face looks symmetric, no droops. So I'm going to have you wrinkle your forehead for me. Raise your eyebrows, smile, frown, and then puff out your cheeks. And close your eyes real tight. Perfect. So everything looks normal on your facial. Number 8 is acoustic. So rub something against your ear and you're going to tell me whenever you hear it and what it is, okay?
Cotton swab.
Okay.
Do a cotton swab.
Okay. And then I'm going to do the Weber's test. I'm going to put a tuning fork on top of your forehead and then tell me where it's coming from, okay?
Okay. Top, middle.
Okay. And then the Ryan's test, I'm going to put this on the side of your mastoid and then tell me when you stop hearing it, okay?
Okay. Okay.
Okay. Now, 9 is your vagus nerve. So, I'm sorry, so I'm gonna watch your swallowing, and then your voice sounds normal, no hoarseness or nasaling, and then you can go ahead and swallow it for me. Okay, with ease, there's no any issues with that, and then cough. Okay. I'm gonna have you say ah for me, and I will look at your palate to make sure it's soft and movement well. Say ah. Okay, looks good. Let's see. And then your gag reflex. Alright, so just give me 1 second and I'll get that ready. Okay. 1, 2. Okay. Alright, so I'm doing number 11, your accessory muscle. I'm going to test your trapezius trophy. So I'm put it on one side of your face and then move this way, like move to the opposite side of where my hand is. And I'm going to feel for your sternocleidomastoid at the same time, okay?
Like move towards your hand or what?
The opposite way. Okay, feels normal. Alright, one more time. Okay, perfect. Everything feels normal. And then no drooping in place, no winging of the scapula. And then I'm going to do one more thing. I'll push down on your shoulders and then you lift up and then there should be no drooping as well, okay? Okay, looks perfect. Lastly, number 12, it's your hypoglossal. And I'm going to inspect your tongue and look for any deviations on either side and then we'll see what's going on. Say ah. Move your tongue back and forth. Okay, perfect. Okay, now I'm gonna move on to your nose. We're gonna see if any issues going on with your nose, and then I'm gonna palpate your frontal and maxillary sinuses. Okay. Okay. So your nose looks normal. It's symmetrical. I'm gonna look into it now and look at your nasal mucosa and your septum. Looks good. And I'm gonna palpate your frontal and maxillary sinuses. This is your frontal right here. Looks normal. And then your sinuses, your maxillary sinuses are right here. No swelling, inflammation, or tenderness at all. Alright, now move on to your throat. So I'm going to inspect your area around the front and then look at your internal mucosa, tongue, sublingual area, gums, and teeth. Okay? So open your mouth again. Alright, looks normal. Tongue is red and moist. And then I'm looking at your gums. Gums are pink, moist, without any lesions, abnormalities. Alright, looks good. Okay, I'm going to look at the posterior pharynx and tonsil area. And it says on your history you don't have any tonsils, right?
Yep, yeah,
Okay.
there's that.
Okay, so I'm going to look at your pharynx. It's also pink, without redness, ulcerations, and your tonsils are gone. Looks good. Okay, next is your lymph nodes. So I'm going to take a look at these. It says you had an inflamed lymph node in May, but that's resolved, right?
Yes.
Okay, so back here is your posterior ocular, back here is your occipital, and then down here is your superficial cervical, and then deep superficial cervical, your posterior cervical, your preocular, your parotid is right here, your tonsillar is back here, your submental is down here, and that's where your issue is, right?
Yeah.
Okay. And then submental is just a little bit, submandibular is just a little bit farther back. Right there. Alright, so do you have any pain when I pushed on those?
No.
Okay. And it feels like your submental is actually resolved, so that's good. Okay. Next we're gonna palpate your thyroid. And we're gonna inspect the left and right, okay? There we go. Okay. So let's see. Your thyroid feels good, no swelling. And I'm gonna look at it with a pen light, and then swallow with me one more time. Okay, no abnormalities when swallowing. I'll palpate it. Okay, I'm gonna look at your trachea. Trachea is symmetrical, no issues, bumps or redness. Alright, I'm gonna look into your eyes. Eyes are symmetrical, their eyebrows look symmetrical, eyelashes look symmetrical, and your eyelids look symmetrical, and open and close your eyes. Okay, there's no lag to them either. Alright, and you denied any issues with your vision, no change in your vision, no pain, redness, swelling, or discharge from your eyes. Your lacrimal ducts feel normal. Your conjunctiva is red, clear, no drainage. Your cornea, your iris, and your lens are clear without any swelling or redness or a shadow. And your sclera looks normal, it's white without any redness or yellow. And then I have the results from your recent eye exam. And your Rosenbaum score was 14 out of 14, which is good. It means you have good vision. And then from your Snellen test, just then you have 20/20 vision, so that's good. Alright, so I'm gonna continue on. Your fundus of your eye is normal without any anything abnormal besides it's being reddened. Your optic disc is correct size, red to pink in color. Your arteries in your eye look normal. Your retina looks normal, and I'm observing the left, right, upper, and the right lower, and the left lower, and part of your retina, and it looks fine. The red reflects when I shine this light into your eye, makes a reddish orange reflection. Okay. And then the macula, which is always performed last, is within normal limits, oval shaped, pigmented near the center of the retina. So you have good eyes. Okay. Okay. You doing okay?
I'm doing good.
Okay. Next, I'm gonna look into your ears. No pain, and did I see any difficulty hearing or changing your hearing? Your arcules feel normal as well as the post-arcual. Alright, I'm gonna palpate your ear and around it, okay? Any pain when I push on them?
Nope.
Okay. And then I'll pull out my instrument right here and look at your canals, tympanic, and your bony structure in your ear. Okay. It looks normal with a little bit of earwax, but that's perfectly normal. Okay. Next, I'm gonna look at your chest and your lungs. Okay. So I might be pressing on. Is that okay with you?
Sure.
Okay. So your chest rises and falls without any chest shape change. No deformities in your chest.
You need me to lay down?
No, you're fine. I'm gonna palpate your ribs and your stomach area if any tenderness, okay? And you said you had tenderness, so just tell me how bad it is.
The right side's a little sore.
Okay. Is your stomach okay?
It's a little sore.
It's a little bit sore. Okay. I'm gonna further assess that in just a little bit, okay?
Okay.
I'm gonna palpate the lymph nodes that are in your chest, your lateral, posterior, and anterior, and then as well as your central group. Okay, I'm gonna listen to your lungs anteriorly and posteriorly. Take a deep breath. Okay, and on the back side. Two more. Okay. Lungs are clear and you, no signs of retractions, impairment, or deformities. I'm going to do tactile firmness now, so I'm going to step on that other side of you and listen for that. I'm going to have you say 99 and listen to make sure I can hear it, okay?
Okay. 99. 99. 99. 99. 99. 99.
Okay. I'm going to percuss your lateral and posterior fields of your lungs. Okay.
It's kind of sore right there.
Okay. Thank you. Okay. So everything feels fine. Alright, so I'm going to palpate your pulses bilaterally if you want to lay back just a little bit, okay? Okay, so I'm going to palpate your carotid, which is on your neck, bilaterally. Okay. Good, strong pulses. I'm going to look at your brachial pulse, and that's on your arm. Can you fix that? Okay, I'll palpate your brachial pulse, which is on the lower part of your arm, okay? Perfect. And then I'm gonna feel your radial pulse, which is on your wrist, okay? Perfect. All +2 so far. Easy to palpate. Your popliteal, which is behind your leg.
Just restart that. Say that.
Do the whole thing again. So your pulse is bilaterally now, okay? The first one's your carotid, which is in your neck. Perfect. I'm gonna do your brachial, which is in your arms. Your radial, which is in your wrist. All +2, easy to palpate. I'm gonna look at your popliteal, which is behind your leg. Just relax it. Okay. And then I'm gonna do your posterior tibia, which is down here. Both sides. And then your dorsalis pedis, which is on top of your foot. Okay. Okay, no sign of bruise at all. Now listen to your renal arteries in your stomach. So I'll have you get underneath this blanket and listen to them, okay? No, you put it. There you go. Okay, no sign, and I'll listen to the renal artery, iliac artery, and femoral artery. Okay, I'm gonna look at your legs for edema. No signs of edema. Legs have good circulation, warm, good for ethnicity. Okay, perfect. Okay, so I'm gonna listen to your pericordium in your chest. I'm gonna palpate it. No signs of lifts or being pulsating. All right, and pericordium is normal. No signs of palpations or lifts. I'm gonna listen to it. And we'll hear any thrills, pulsations, or lifts. Okay. I'm gonna listen to your heart. Well, I'm going to use the diaphragm and the bell on this one. So, listen to your aortic, pulmonic, Erb's point, tricuspid, and your mitral. And then this is the bell side. Aortic, pulmonic, Erb's point, tricuspid, and your mitral. Okay, everything sounds good. Your heart has a good heart rate. No skipping of beats, no murmurs. It sounds great. All right, now I'm gonna do your abdomen. So if you mind pulling up your shirt just a little bit, okay? And I noticed some scratches on you. What are these from?
My dog.
Okay. All
A
right.
little feisty.
Okay. So I'm looking at your abdomen, including your skin, your belly button. Let's see, you don't have any peristaltic waves or pulsations. I'm gonna listen to your bowel sounds and see if you have any bruise in there, okay?
Mm-hmm. It kind of hurts when you push on it.
Okay. Sorry. Okay, bowel sounds are present in all 4 quadrants, no signs of bruise. Okay, I'm gonna percuss your abdomen a little bit, okay? There's 9 quadrants, and I'm gonna go, your upper right, middle, upper left, and then so on, okay?
Mm-hmm.
Okay. That hurts a little bit?
Yeah.
Okay.
Yeah.
No, also hurts all the way down?
Yeah.
Okay. Does this hurt your stomach at all?
Not over here.
Okay, everything sounds fine. I'm gonna percuss your liver, which is your right upper quadrant. So I'm sorry if this hurts a little bit.
Yeah.
Okay. Alright, I'm gonna palpate all 4 quadrants and how bad does this hurt on a 0 to 10 scale?
Probably like 8 or 9.
Right now at 8 or 9? Okay, everything feels normal. your kidneys, as that's where the pain probably is if it's hurting on that side. So I'm gonna assess for CVA tenderness, okay? Just over back here. That hurts really bad, okay.
Yep.
Alright, does it hurt without palpation also?
Yes.
Okay. Alright, so we did this earlier, but I'm gonna go ahead and do it in my musculoskeletal part of the assessment. So let's do a TMJ, so I'm gonna have you open and close your mouth and then shift it from side to side, okay? Okay. And then open from side to side. Okay, your jaw's symmetrical, no deformities, swelling or redness. Palpate for tenderness in your joints. And then everything else feels normal, correct? Okay. Alright, no signs of swelling or anything like that. Okay, so we're gonna do your range of motion. Put your shirt back on. So we're gonna do your range of motion. So if you wanna stand up for me, okay? Okay, now we're gonna perform range of motion on each skeletal part. So if you mind standing up for me. Okay, so I'm gonna look at your spine. If you'll turn around. Okay, it looks laterally and posteriorly to determine. So symmetrical. Your curvature is great. And your level of the iliac crest, which is right here, is normal. And your scapula and shoulders feel normal. Okay? Alright. So we'll do your upper extremities first, which include your shoulders, elbows, wrists, and hands. So your shoulders, I'm going to have you flex up, so go like this. Does that feel okay? Extension. Okay. Abductions is put your arms outside like this. And then, I'm sorry, go like this. And then abduct is put them back. Alright, your internal rotation, go like this. And then your external. Does everything feel okay? Okay. Next will be your elbows. So if you'll, flexation, it's kind of like a bicep curl. Does everything feel okay? Extension is put it back down, which you did great. Pronation, you're gonna put your hands like this. And then, subnation. Everything feel okay? Okay. Your wrist, I'm gonna have you do flexation first. You're gonna put your wrist down. And then extension is put your wrist back up. And lateral is moving from side to side. And then rotation is put them in a circle. Everything feel okay? Okay. So everything's within normal limits so far. Good range of motion. Hands, I'm gonna have you close your wrist. Open your wrist. Okay, I'm sorry, your fingers. And then abduct your fingers, just spread them apart. Put them back together, okay? And then flexation is of the thumb. So extension is put the thumb out, and then flexation is put it in. Okay, good job. And then I'll have you do hand grips. So if you grab my hands and squeeze them. Good hand grips bilaterally. Okay, so we're gonna do your lower extremities. Your hips, knees, ankles, and feet. So, medial rotation is put your toes together. Lateral, put them apart. And then extension is flexation is put it forward. And then extension's back. Okay, and then the other side. Flexation, extension. Okay? Okay, well you had a little bit of losing your balance, but I think that's okay. I think you're just so hungry. That's okay. And then abduct, you're gonna put your leg out. Put it back in. Other side. Put it back in. Okay, and now just that's your hips. Everything sounded good, no clicking, good range of motion. We're gonna do your knees now. So dorsiflex, so put your ankle to the sky and then put it back down. Okay? Now it's plantar afterwards. And then inversion, exversion, or inversion or eversion. So inversion is put your ankle to the side and put to the other side, which is extension, both sides. Eversion, exversion. Okay? And then move your feet in a circle. And then the other side. Okay? I'm gonna get you back in the bed and I'm gonna test a few more things, okay? we have one more range of motion to do. Or look at your feet. So your feet and toes, flex and extend all your toes. Okay? And then put them back down. Like this, there you go. And then extend them. Okay? Perfect. So now I'm gonna do a monofilament test, which is I'm gonna rub something sharp on your foot, and then you apply back whenever you feel it, okay?
Mhm.
So just close your eyes.
Yeah. 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 Yeah.
Okay, so good sensation in your feet. I'm gonna put a vibrating sense on your thumb, wrist, digit, and your great toe. So, go. So your thumb, so close your eyes. Let me know when you feel the vibration, okay?
Mhm. Yeah. Yeah. Mhm. Yeah. 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 Yep. Yep.
Okay. And then I'll do it on your wrists, bilaterally. And you can feel all the senses and your vibrations, and then your big toe. Okay, perfect. I'm gonna do proprioception, so I'm gonna put a light point again on your thumb and great toe. Make sure you can feel where your digits are, okay? Okay. Okay, good proprioception. So point to point, I'm gonna have you point your finger to your nose and then your heel to your shin, okay? So go. Okay, perfect. And then put your heel on your shin. And then one more on the other side. Okay, perfect. And then rapid alternating is finger to thumb, hand rotations, and feet tapping. So go finger to thumb, so go on both hands. Okay, and then hand rotations, so go like this, okay? And then feet tapping, just tap on the ends of the bed. Okay, perfect.
Stop it.
Okay, I'm gonna have you sit on the side of the bed so I can test your tendon reflexes, which is the very last part of your assessment. The first one is your bicep reflex, where I hit the inner arm at your crease. Okay. Okay. And then I'm gonna do your brachioradialis, which is I'm gonna hit the inner forearm. Okay. I'm gonna do your tricep, where I hit your elbow, so sit like this. Perfect. I'm gonna hit your patellar, which is right below your kneecap. Perfect. I'm gonna hit your, you can't really see it, so get back in the bed. I'm gonna hit your ankle, which is your Aculus. Okay, perfect. Good reflexes, +2. Okay. And your plantar, which is the bottom of your foot. Okay. Perfect. All right. So we are done. Thanks for being a good sport. Everything looks good besides the right flank pain that goes to your stomach and your back. So we'll get that assessed by the doctor. I'll make the doctor aware of your assessment, and he'll be ready to see you, okay?
Alrighty.
Do you have any questions for me?
I think I'm good.
Okay, thank you.
Alright.